Yo juro lealtad a la bandera de los Estados Unidos de América, una república que representa. Anna, can you hear me all right?
Yeah, I can.
Cool. No. That's the Pledge of Allegiance in Spanish. Yeah. I grew up in Central California, so occupational hazard is picking up some Spanish. Okay, Hannah, do the slides move? Are they moving? Yes or no, are they moving? All right, folks. Good evening. So we have a quiz, but before we do the quiz, so on the Blackboard site, there are some drug calculation problems, and they're meant to help you practice. What I did with the drug calculation problems is there's a problem, it's worked out, and then it gives you problems to do to practice. So when Minnie looked those over last year, she said, these are too hard. They're more than nurses will be required to do because I had you compound and stuff like that. Some nurses in Michigan don't compound unless they're nurse anesthetists. But she did like the rates of the IV rates and the piggybacks and that sort of thing. She liked that. So what I did was so if you use that as a practice, I have some calculations here for you to work out. These are like unto what you'll do essentially with drug calculations. You really have to be able to do drug calculations. And in the past, the students in this program have been math phobic, and I'm discovering our students are becoming less math phobic as they discover they have to figure out drug calculations, drug concentrations, and what have you. I should tell you this little minor story. So I had a procedure, and I was talking to the recovery nurse, and she brings me this vial. She said, I'm supposed to give you so much of this, but they changed the vials, and I got to figure this out. I said, well, I'm the charge nurse. She said, well, the charge nurse isn't around. And then she said, you teach fine, can you help me? Now, mind you, I'm recovering from anesthesia. I said, well, yeah. So I took a napkin because, they give you very dry crackers and juice, and I did it on the napkin. It was easy. Even in the fog of anesthesia, I could still do it. And I said, well, there, that look right? You should probably check that. She said, oh, that's fine. And she gave me the shot. Okay. Do not ask your patient recovering from anesthesia to calculate the drug for you. All right. I kind of, when I got out of the hospital, I was just going, what the heck happened? Because when you wake up from anesthesia, you're dopey. You don't always remember things exactly the way they happen. So please don't do that to a patient. But anyway. No. But the rumor had gotten around that I taught pharm, so she said, well, I have to be on my best behavior, pharmacologically speaking, which I said, what does that mean? I thought she was just playing with me, but she was serious. She did not know how to calculate X amount of, painkiller, and so she had me do it. Just like, don't be that nurse, okay? So these are meant essentially to make sure that you have the confidence to be able to calculate drug calculations. If you want sample calculations, there's a drug calculation file, there's 4 different calculations. Each one, the first one starts out very simple in its presentation and calculations. Person needs this much of something, it comes like this, how much do you do? Then the second one gets a little more involved with liquid drugs and things like that. And then the last 2 are IV drip rates and things like that, which you'll need to know how to do. So, so this is meant essentially as an assignment to demonstrate, because one thing Mindy really wants is for me to be able to say, oh, look, see, they can do drug calculations. So the practice problems essentially, we're going to ask me, will I give you the answers?
No, I was gonna say, the stuff that's on Blackboard, is that what we're turning in for a grade, or are we turning?
No, you're turning this in. That's for practice,
Okay.
because that has worked problems. And then it gives you problems to do using the same strategy as a worked
To
problem.
kind of like understand what we're doing and then.
Yeah, in fact, go ahead and open one and you'll see what I mean. I mean, literally it starts off with read this label. Because you'd be surprised how many people don't know how to read a label. So, and if you go through it, works a problem, and then it gives you problems to do, and then it works another one, and it gives you problems to do. So it's practice. Yeah. And if you go through, you'll see the work problems. Maddie, you seen it? Did you look it up, or are you just, no, you're doing something else? Okay. I'll hand these out during the night before we leave, and those are much easier than the ones on the practice line. Those are, and these are a lot like what you'll do essentially in your job as a nurse.
That can account for all of our dosage calculations.
Yeah.
Okay.
If you don't like these questions, blame Clara, she wrote most of them. Did you look at it? See what I mean? Yeah. So it's exactly- It's just.
She wanted a girl's vacation.
Oh, she wants to learn everything. Okay. You know what? She told me she wasn't.
Myself farther away.
Let's see, you're 2 angles. Yeah, okay. Yeah, I'm still waiting for the day when we have nice weather, and then maybe we'll meet outside. But we're not meeting outside now. Very humid and wet, and yeah, no place to sit, and yeah. No. All right, so we talked last time about some GI drugs. We looked at laxatives. We looked at antidiarrheals. And we started to look at contraceptives. What are the two main types of IUDs? Hormonal, non-hormonal. The non-hormonal ones are made of copper. Does it matter with regard to the woman's period when you insert the copper ones? No, you can insert them anytime during her menstrual cycle. How about the hormonal ones? Oh, wrong button. That's the one. The hormonal ones, if you don't want to have to use backup birth control, then you insert it when? Yeah, 1 to 5 days when they start menses. Otherwise, you can insert it at other times, but you need backup birth control then. So another type 1 birth control would be the so-called subdermal implants. And this is a progestin. And you can see it's a rather ingenious insert. It's a plastic insert. It's just put underneath the skin, and it very slowly releases a synthetic progestin. And this is called Nexplanon. So this releases this progestin called etonogestrel. You just place it, it's very small, as you can see. It's put inside the upper arm, either the left or the right arm, usually the non-dominant arm. And it releases this low dose of etonogestrel. This will usually last for 3 years. You don't need to take any pills. You don't require any other adherence other than a replacement after 4 years, essentially. It goes out and then you come in, you do get some bleeding irregularities like you do with progestins. So it's inserted essentially with a small device like this. It takes 5 minutes essentially to insert it. You insert it at 1 to 5 days of the menstrual cycle for immediate effect. If you do it another time, you have to have backup contraception until your next period. And it's inserted under local anesthesia by your family doctor, essentially. The adverse effects are really common relative to what you expect from synthetic progestins. So the irregular menstrual bleeding is the most common side effect. You can have periods that are shorter, periods that are longer, periods that are absent, that sort of thing. So that if you're okay with that, then it's usually not an issue. Within removal of the rod, most women, by most, it's in the 90% will ovulate within a year. If you want additional contraception, you can insert another rod and Bob's your uncle, and there you are. And if, say, you want to get pregnant, you can have the rod taken out. Does it leave a scar when you take it out? The answer is a very small one. And that scar will usually contract. And also, since it's on the inside of your arm, it's usually not an issue. Some women get headaches. That tends to occur at first, tends to go away. Some women will experience bloating and weight gain. Acne is a problem with progestins. And the acne is actually relatively common. The severity of the acne really varies from woman to woman. Breast tenderness is also a complaint. Usually in the first year, that tends to go away though. So that's Nexplanon is the name of the product. Again, inserted sub-Q inside the arm. No adherence is necessary. So those are your tier 1 methods. Those don't require any adherence once the device is inserted, be it an IUD or Nexplanon. You could basically, it's kind of like a bulb. You plant a bulb and then you forget about it and then you get a plant, essentially. It's kind of this way too. The device is inserted and you don't have to worry about it. You don't have to worry about taking tablets. You don't have to worry about any of that other stuff, essentially. And since compliance is one of the major issues with oral contraceptive pills, the tier 1 methods don't require compliance. So if you have a client, a patient, and compliance is a big issue for them, but they really don't want to get pregnant, this is a genuine possibility. Are there any questions about tier 1 methods? Let's talk about tier 2 based methods. So these are your birth control pills. There's 2 main types. There are the so-called mini pills, which are progestin only pills. So if you remember from A&P, in the menstrual cycle, you have the production of gonadotropins because of gonadotropin releasing hormone from the hypothalamus. These will cause the ovarian follicles to grow and to mature. Eventually, as those follicle cells start to make estrogen, the estrogen levels will get to such a high level that you start to get a pulsatile release of the gonadotropins. You get a peak of, in particular, luteinizing hormone. That causes ovulation. And then the follicle cells that remain become a corpus luteum. They make progesterone and estrogen. And progesterone suppresses gonadotropin production by the anterior pituitary. So the progestins act essentially like a would-be corpus luteum, if you will. And they suppress the gonadotropins. So the ovarian follicles don't develop, ovulation doesn't occur. They thin also the endometrial lining. And so if fertilization does occur, the embryo will not implant. So I get asked this question every year. Let me just anticipate it. Yes, these pills are potentially abortifacients. Because are they completely successful at preventing ovulation? Not completely. They're in the 90 percentiles, but they're not perfect. So should an egg get fertilized and a zygote is made, it won't be able to implant successfully typically. They also thicken cervical mucus, so the sperm have trouble penetrating. That's an additional plus, if you will, with these, but they're not perfect, and so they are potentially abortifacient. Most of your mini pills will contain this synthetic progestin, norethindrone, at a relatively low dose. So this comes in the form of products like Liza, Nora-B, Nor-QD, Ortho-Micronor, Agestin, AYGESTIN, Camila, Erin. These are your products like that that are progestin only. There's a new mini pill. It has the progestin drospirenone. This one doesn't seem to cause acne trouble. It potentially might even improve it. So you get some of the other types of side effects of synthetic progestins: headache, nausea, irregular bleeding, breast tenderness, weight gain, irregular periods, decreased sex drive. Some people have seen high blood glucose levels and also a lack of periods altogether. It can increase serum potassium levels. So there's a blood test you'll have to have when you first go on it. Most women tolerate it just fine if you hydrate sufficiently. It's usually not an issue, speaking of hydrating. So mini pills are quite good if you have a client who just has these really heavy menstrual bleeds, or they have pelvic pain due to endometriosis, or they have ovarian cysts or something like that. Mini pills are really good for abating the heavy bleeding, relieving the pain, and the pain of the cysts and the pain of endometriosis and what have you. If you have polycystic ovary disease and you have these conditions, the mini pills can also be very effective for those conditions as well. There might be a role for them in hormone replacement therapy in people who have some sort of primary hypogonadism. So folks who have Turner syndrome, that is, they only have one X chromosome, or they have some sort of premature ovarian failure for any variety of reasons. So these are the things for which mini pills work quite well. Mini pills are preferred in breastfeeding women. Estrogen will tend to reduce your milk supply. Mini pills will not. You start them on the first day of your menstrual cycle. If you start them more than 5 days after the menstrual cycle, then you need to use some sort of backup contraception for about a week. With virtually all birth control pills, all oral contraceptives, all tier 2s, you have to take it the same time every day. Same time every day. So I think this is easier with cell phones. You can set the cell phone to buzz or beep, or a mallet comes out of it and hits you over the head or something or whatever. And that will remind you essentially to take it at the same time every day. So people who take mini pills report decreased menstrual blood loss, which for some people is a big plus. Decreased menstrual cramping and pain. They're an option for women who can't use estrogen. For example, women who are over 35 or women who still smoke, for whom estrogen really increases the risk of venous thromboembolism. Mini pills are the preferred birth control, oral birth control in that case. So mini pills can cause spotting or irregular bleeds. They can cause headaches. They tend to cause headaches in people more prone to them. Mood swings have been reported. How bad are the mood swings varies from person to person. Breast tenderness is actually rather common. There is an increased risk of ovarian cysts. That risk varies depending upon your risk, familial risk in general. And once you stop the mini pill, your fertility gets restored after one cycle. So very convenient. When do you not use a mini pill? You have active liver disease because the drug is metabolized by the liver. If you have active liver disease, you can't use a mini pill. If you have breast cancer, can't use a mini pill. And there are some drug-drug interactions. So the anti-seizure meds that tend to activate cytochrome P450s. Those will break down, increase the degradation of the progestin, and you'll have treatment failure. HIV protease inhibitors, these two in particular, ritonavir and impregnavir. Cephalosporins, macrolides, and penicillins can mess with the metabolism of many pills. So can the anti-leprosy drug dapsone and the antifungal drug rhizofolvin. And then, of course, the herbal remedy, St. John's wort. There are actually quite a few case studies of women getting pregnant on many pills when they take St. John's wort, because St. John's wort induces several cytochrome P450s, in particular, cytochrome P450-3,4A, which is one of the major enzymes that metabolizes synthetic progestins. There are lots of these mini pill products on the market. They all work about the same. If someone doesn't get satisfactory circumstances, results with one, they can switch to another. And many women who can't tolerate one can often tolerate another. Does anyone have any questions about mini pills? The progestin only pills. What are you going to tell your client when they get this prescription from the provider? What advice are you going to give them? Same time, every single day. Remind yourself, set it on your phone. In fact, have them get their phone out and set the reminder right there in the room. Because very often, oh yeah, I'll set a reminder, and they leave and they forget. So have them pull out their phone and set the reminder right then and there. What sort of things should you tell them to expect, potentially? Spotting, regular bleeding, right? What else? Potentially headaches. Might want to ask them, do you get headaches often? If they say, yeah, they say, oh, this will make your headaches worse, probably. Their side effect profiles are really common, but some women who switch to one brand to another don't get headaches. So don't ask me why. It just, that's what happens. You talk to OBs or you talk to OB nurses and they'll say it's like magic. It just, headaches go away. So that's why if something is not successful, they really can't switch to something else. There are lots of options. Combination pills. So these are pills with estrogen and progestin. Estrogen and progestin. The synthetic estrogen is usually ethinyl estradiol. And then there are several different types of progestins that are used. The exception is this drug, Natasia, which uses estrogen valerate. That's the only other estrogen that's used. Most of them use ethinyl estradiol. That's the one you see used most often. So these two synthetic progestins, norethindrone and levonorgestrel, those are made from testosterone synthetically. They have some androgenic activity, so they can increase your serum cholesterol, your serum LDL levels. For young women, that's usually not much of an issue, but it might be, in which case you should probably avoid those particular progestins. These others, drospirenone, dasodrestal, and dienogest, they have anti-androgenic properties, and they're supposed to improve acne. So the drospirenone does improve hirsutism, that is the growth of hair on the face. It does improve acne. And it tends to improve the mood swings that are associated with the menstrual cycle. But given the fact that these things can mess with lipid profiles, if it's in red, that means it's important. So women on the combination pills, they should have their lipid panels checked on a regular basis. So here are the different types of products that are available when it comes to combination birth control pills. Monophasic pills have the same amount of progestin and estrogen in the tablet that you take your whole period, with the exception of the last week, which is placebo. So it doesn't vary in the amount that you take. Biphasic, excuse me. Biphasic tablets come in two versions of the tablet, and they will vary the amount of either the estrogen or the progestin. Triphasic will have three types of pills that will vary the concentration of those tablets as you go through your period. Why do they do this? It's an attempt to use lower doses early in the menstrual cycle and then ramp it up when you're going to need it the most, when you're most likely to get pregnant, and therefore give you better control, prevention of pregnancy at that time. Then there are the so-called four-phasic. The four-phasic pills have 4 different concentrations throughout the period. Extended cycle pills are 91-day pills that you take continuously. These essentially can prevent you from having periods. So there's about 5 of these products. And then the continuous pills, essentially there are no placebos in the pill. You just keep taking them and keep taking them and keep taking them, and you will not have a period on a continuous pill. The multiphasic pills usually will be different colors, and that will indicate essentially when the dose changes. McKenna, you had a question?
Yeah, so for, I have somebody's pregnant, like it's normal, but it's really not. Would it be fine? Go that long time?
Yeah, it seems. For a long time, the theory was that the menstrual cycle helped purge the uterus. So any microbes or any anything in the uterus that was potentially undesirable was purged with a period, and periods essentially helped keep the uterus healthy. Now it turns out that not having a period for a while was thought to potentially be deleterious to the woman, but the data we have so far says that's probably not the case, albeit there's really no long-term data so far on this. So on that, I'd say keep an open mind. So the monophasic pill have 24 active pills and 4 inactive pills. The 3 pill packs that contain 24 days of hormone pills and 4 days of placebo pills, that will result in a shorter, lighter period. The pills may contain a combination of either drospirenone and ethinyl estradiol. So that would, products like, as you can see here, Yaz, Zara, Yasmin, Ocella, those are examples of ones that have drospirenone, excuse me, and ethinyl estradiol. Others may have other types of progestins. There's this product called Biaz. Biaz has, where is it? Oh, there it is. That one, as you can see, has folic acid because the period that you have is supposed to deprive you of folic acid. So it actually gives you some folic acid. Again, I'm not aware of good clinical data that says that actually helps the lady, but it's not a bad idea to try. So these particular tablets, as you can see, Safaril and Biaz, they have folic acid. And then blah, blah, blah. And the punchline is these are the 24-4 pills. 24-4. Monophasic, so they have the same amount of hormone in each pill. The pills are not color-coded because they're all the same thing except the placebos are marked. I think they have a P on them. You're supposed to take the placebos to get in the habit of taking this tablet the same time every day. Some ladies will say, oh, I won't take the placebos. Then invariably, after 4 days, they forget to take the other tablets. That's why you're supposed to take the placebos. So encourage your clients, please take the placebos. So you get in the habit and just forget that they're placebos because you have to take them same time every day.
You said that there's 4 activated pills, non-activated pills, or 4 and 4?
There's 24 active pills and 4 inactive pills, or 4 of the pills are placebos. So the 3 packs now are quite popular. Those are your monophasics. So the biphasic tablets that you can see here, they have the same amount of estrogen, but the progestin dose gets increased halfway through the cycle. That will shut down the gonadotropin production and release by the anterior pituitary. So you can see the progestin is going to vary a bit in these different products here and what have you. And there's different products and, you know, what have you and blah, blah, blah. Those are the biphasics. Some of these pills, by the way, will come in 21 pill packs. So you take the 21 pills for 3 weeks, and then you wait a week, and then you get another package. Because you can do medications now with your phone, with these programs, a lot of insurance companies now, it's cheaper essentially to you get the pack essentially mailed to you when you're supposed to start taking it, provided, you know, FedEx doesn't screw up or something like that. And the packet, that seems to me to be a little dicey, but you're depending upon the delivery service. Anyway, so there's the 24 pill packets, and then there's the 28 pill packets that have 21 active pills, 21 active pills, 7 placebos. So you take the 21 and then you take the 7 placebos. The other ones that we talked about are the 24 active, 4 inactive. Some of these tablets too, here they have put iron into the tablet in order to help you recoup the iron you lose with the period. Because of the competition, some of these companies are trying to get really creative. Bottom line, if you don't find one product satisfactory, you can switch to another. Triphasic pills, 3 different doses of progestin and estrogen that will change every 7 days. So you can see they have names like 777 after them. That tells you it's a triphasic pill. Also, Trinesa, Trivora, Trinoril, Norinil, blah, blah, blah. That tells you it's a triphasic pill. So the 4 phasics have 4 different doses of progestin and estrogen during the 28-day cycle. There aren't very many of these products, but there's a Natasia that has the estrogen valerate, and then something called Quartet, which is kind of a cool name for a quadriphasic pill. That has a levonorgestrel and ethinyl estradiol, so on and so forth. Then the continuous oral contraceptives. You have 91 days of the contraceptive pill, constant dose of estrogen and progestin, so they're monophasic, but you don't have placebos. There are 1, 2, 3, 4, 5, 6, 7 of these products. You take them for 84 days, and then you have 7 pills that are placebos. So they're marketed under Seasonal, Seasonique, Low Seasonique, Jalessa, Quascent, so on and so forth. You might have some light bleeding or spotting of blood if you use the extended pills, but you will not typically have periods. All right, so the continuous tablets, as you can see, they just eliminate periods altogether. And again, lots of these products available. They're just, companies are really competing for each other for the rights to who's the king of the block on these and what have you. So say, Maddie, say Sydney's your patient, and say Cindy comes in and she says, I'm getting married. I want some combination birth control pills, and you say, congratulations. And next, first thing you have to do, pregnancy test. And it must be negative. If it's not negative, no pills. No pills. Next thing you're going to ask her, read the slide. Went right. When was the first day of your last menstrual period? It was less than 7 days ago. Start them immediately. Start them immediately. Use backup contraception for a week. More than 7 days. Was there an episode of unprotected sex? If the answer is no, then you can start it, but you have to use backup contraception for a week. If the last episode of unprotected sex was less than 5 days ago, then you might want to consider emergency contraception. and the pill started the same day. Now, let's say she tells you something like, you're going to be nurses, I can be crass. It's okay, I was bleeding. Let's say she says something like that. In which case your chances of getting pregnant are pretty slim. Agreed? I didn't know she's telling you the truth. Can you assume she's telling you the truth? No, you have to follow protocol. It's the rules. You follow protocol. This is a protocol essentially that comes with the drug inserts. Your doctor's office or hospital might have another protocol. When in doubt, follow it. All right? Retest for pregnancy 2 weeks later to confirm she's not pregnant. If that's the case, you've already given her the pills. She's already started taking them, and so everything's good. So you can do what's called a quick start. You get the pills, start taking them, bang. Use backup contraception for 7 days and should be good to go. Or you can use the Sunday start. You start the Sunday after your period begins and use backup contraception for 7 days. Or you can do a first day start. Take the pills on the first day of menstruation, no backup contraception is needed then. So those are 3 ways to start the combination pills. Yes.
So if you're the first day start, you're taking the pill on the first day, did you start on the placebo week then?
No, you start taking the tablets.
So pills are always like lined up to where the placebo is on the week of-
Yes, but for your menstrual cycle will usually start to coordinate with the tablets. So, and if your menstrual cycle starts to get irregular, you need to see your OB because usually these tablets will tend to make your menstrual cycle pretty regular, which is one of the reasons why they are used by OBs for ladies with very irregular menstrual cycles. So you get 21/7, 21 on, 7 placebos. You get 24 fours, 24 active, 4 placebos. The extendeds are 7 placebos are taken every 3 months. And you'll have 4 periods a year during when you take the placebos. If you use the continuous ones, where you just take it continuously, you will not have a period. So what are the advantages of the continuous use? They're very good for endometriosis because people with endometriosis, as they have a period, the tissue that is stuck, the uterine tissue that's stuck to other tissues will bleed. If they bleed internally, they can be downright miserable. So they're very good essentially for people with endometriosis. Secondly, if you have someone with hyperandrogenism, remember, in the follicle, you have 2 populations of cells. You have the thecal cells, and then you have the granulosa cells. The thecal cells are induced by luteinizing hormone to make what? Starts with a T, ends with own. Testosterone. The granulosa cells, in response to follicle stimulating hormone, make the alpha aromatase that converts testosterone into estrogen. So this is the reason why, if you get these follicles, these cysts in your ovaries, they can make a lot of testosterone and cause weight gain and facial hair, hirsutism, and these types of things. So because periods can make those types of side effects a lot worse, continuous pills can essentially wipe that out. They're very good for that. They're also good for premature ovarian failure. Because with premature ovarian failure, you don't make a lot of these hormones, giving these hormones, and they can essentially help the lady essentially have the benefits of estrogen and what have you. They are also used in some cases for hormone replacement for women going through menopause whose periods now start to become very irregular. Now, the wisdom of that is very questionable. In some cases, if the irregular periods get very heavy, then they can be used usually to make the periods more regular, not as heavy, and until the periods stop, and then you just take them off the medication. So some of the main benefits of the combination pills is that you have a improved menstrual cycle, you have less bleeding and less cramps. You also, unlike the mini pills, you have a much lower risk of ovarian cysts. Estrogen also is very good for your skin. Whereas the progestin can cause acne, estrogen will make your skin look really great. And you have a decreased risk of certain cancers. So you have decreased risk of ovarian and endometrial cancer. They also will prevent bone density loss in women who've attained their peak bone mass, generally women over 30. If you have excessive body hair, they can improve that. They can decrease benign breast disease or breast cysts. The coughing's not bad enough. They can also prevent the mood swings that comes with premenstrual dysphoric disorder, formerly called premenstrual syndrome. Now it's called premenstrual dysphoric disorder. Only two have been shown to be useful for this. That's Yaz and B-Yaz. The others are probably effective for it, but they haven't been tested. So what are some potential side effects of the combination pills? They might cause headache. They might cause nausea. In most women, the headaches and the nausea, you get them at first and then they go away. They do cause bloating, but with the phase pills, the bloating is not nearly as bad, typically. You may get some breakthrough bleeding. That's a result of the low dose ethinyl estradiol. And again, the drospirenone can cause hyperkalemia. So you should have that checked on a regular basis. If you have higher doses of ethinyl estradiol, or really any estrogen, so you're looking at above or equal to 50 micrograms, my bad. You have increased risk of ischemic stroke and myocardial infarction because you have increased risk of VTE. That's particularly the case in women who smoked or have hypertension. And this risk goes up as you get older. It's also the case, risk goes up in women who are obese. Define obese for me medically. Very good. BMI of over equal to or over 30. Very good. And some progestins, when combined with estrogen, will produce a higher risk of venous thromboembolism than levonorgestrel. Breast cancer. The jury's still out on this one. First, it was thought to be protective. Then it was thought to cause a greater risk of breast cancer. That's what the old pills that had really high levels of estrogen. Now it's not clear. In women who have tendencies toward depression, it can sometimes make the depression worse. So depression might be an issue. Usually it's not an issue if you're not prone to depression, but if you do have a tendency toward depression, might be an issue. Rifampin, antiretrovirals, anticonvulsants, and St. John's warts all increase the liver enzymes that will degrade the estrogens in particular. So you get treatment failure if you combine these oral contraceptives with those medications. There are lots and lots of reports on the web that non-rifampin antibiotics will mess with your birth control. That is not true. Those have been tested rigorously and they are not true. You heard it here first, or maybe second, I don't know. Now, some questions you might want to ask your patient before they take these pills away. Why don't you ask them these questions? Just some, are you this type of person? Are you the type of person who can remember to take a pill every day? The answer is no. Might want to consider a tier 1 type of birth control. Question 2. If you are at risk for sexually transmitted infections, will you have your partner use a condom? Question 3. Do you need relief from endometriosis, anemia, or severe menstrual pain? Question 4. Do you suffer from premenstrual dysphoric disorder? Question 5. If you smoke cigarettes or vape, are you under the age of 35? If you're breastfeeding, is your baby 6 months or older? Penultimate question, do you have high blood pressure? Final question, have you used a combination pill in the past? And if you did, how did it go? Those are all potential questions you might want to ask your patient, client, whatever. Questions? Yes, McKenna.
Okay. I have a long question. The pill, these pills, most of birth control pills, they block the egg from being released.
Yeah.
So I've heard, and I don't remember this section from A&P, but are women born with all the eggs they will ever have, or do they continue?
Yes.
So
There was a report 10 years ago that there's a stem cell population in the ovary that can make eggs. That turns out to be possibly true in rodents, but not in humans.
So if it keeps them from being released, does that mean they keep those eggs, or they kind of?
Yes, they keep those eggs, but keep in mind those eggs age
Yeah.
and their quality can go down.
Okay.
So that doesn't mean your fertility will last longer. It just means you have fewer eggs that never had the chance to present themselves in your fallopian tubes for sperm to fertilize. Gee, that was long-winded. Yeah, Becca? Doesn't seem to. Doesn't seem to, but again, long-term studies are lacking. Short-term studies say no, but long-term studies are lacking. Let's say you go on a continuous pill, all of a sudden you meet the love of your life, you want to have 13 kids. You can get pregnant right away. Plenty of women get pregnant right away. Now, can you have 13 kids? That study really hasn't been done. Does it mean that your egg reserves are not as good as they were before? That's not known. That really isn't known. So there's some work on this that needs to be done. So watch this space. All right, let's go ahead and take a break. We'll talk about the transdermal patch next. So take 5 and yeah.
Since I was 15. Oh my gosh, let me tell you, I take the combination pills, what did you say? The trifling? I take the 777. I'm not gonna. So I haven't, like I said, I've been taking different varieties of that kind since I've been 15. I'm 22 now. So I had periods when I first started my period. I was 13, 12, and I would go all week, heavy all week, and be so bad. I remember I used to get sick at school growing up, and that was terrible. Eventually, my mom put me on. I got on birth control, and yeah, now my periods. I know exactly when I'm gonna start. I always know. I start on a Thursday, and it's in the morning. And my first day is pretty normal, and then my second day is my heaviest, and then I go until like Saturday, Sunday, and it's like yeah, and I cramp maybe 5 minutes, or like twice a day the second day, and it's not that far. But before it was like hours. I was like cramping. My sister actually, she got me on birth control sooner than I did because her period, she was having like periods nonstop. Yeah, that's what my sister was doing. She got put on birth control. She just has a lot of issues, honestly. I don't know what's wrong with her, but she, yeah, putting her on birth control helped to regulate her period because she was having a lot. Like, I couldn't imagine. I can't imagine you. I'm just saying. The one he was talking about, he was saying, I don't know how much time would you take? Why not? Why not? Why hasn't this one been offered? Oh, yeah. So with all of yeah, that was my mom. So like,
I think you're making.
you said that.
You're very boss.
My great-grandma, my grandma, and my mom.
But you still do these.
And my mom, they're super obviously like open enough to where having a conversation about it. Sorry, it was like, we don't have that conversation. And it wasn't at the time when I started it, I wasn't using it for them. So like it wasn't. Oh. Can I have some more?
Sure, I can give you three.
For Brooke and Natalie.
Oh, yeah.
Thank you.
I think we're gonna be due, if I gave you an extra one, you should adjust it.
So mine is 3 days after. This is last week. And it's Sunday, right? It starts on Sunday, Monday, Tuesday, Wednesday, so 4 days after. No. It's not right. I don't know. It always starts on Wednesday. But, yeah. But, it would have to, I never had that. I didn't get.
All right, gang, let's soldier on. So Xulane is a transdermal patch, and this will deliver the ethinyl estradiol and the normal gestronin in a patch, so you don't have to take tablets every day. You just put the patch on, you apply it every 3 weeks. It seems to be as effective as oral contraceptives, but in obese women, it doesn't seem to be as effective. Its adverse effect profile is pretty similar to what you see with the oral contraceptives. Again, the rules we talked about for putting transdermal medicines on still apply. You want to make sure that the spot you put it on is clean. You want to make sure that you don't get the medicine on your fingers. You should probably wear gloves or something. Hands should be clean. Make sure you wash your hands afterwards. You should probably label the patch before you put it on. Trying to remember when you put it on might be a fool's venture. So label it with the date and then put it on, or essentially you can put it on your phone when you put it on or something like that, and then put a note in the phone as to when you're going to take it off, something like that. You can apply the patch here. It's on the arm. You can also put it on the lower abdomen. You can put it on your rump. You can put it on the arm. You can get scared and irritation at the site of application. If you rotate it, that's usually not much of a problem. The cool thing about this patch is water resistant. You go swimming with it, and you take a shower with it, and it stays on. Which you gotta admit is kind of cool. This is a newer product called Twirla. This was approved early last year. So this has, again, yes. Because of the medication is not water soluble, and the vehicle that it's in seals it around the patch, so it's resistant to water. If you get the patch on and it's not smooth and you get a crinkle in it so water can get in it, that can mess with it. But the patch is designed to be able to stick in the water and be able to hang on. The product was pretty heavily tested and it stays on in the water, which I admit is pretty ingenious. Yes.
Wouldn't like
the heat from the shower have any effect on how fast?
It could. So you're not supposed to not supposed to get out of a hot tub and have the hot tub nailing you with, you put it on your backside, say, and that you're supposed to stay away from hot tub jets, and you're not supposed to have the water pouring on it. So if the water's dripping down on you, la 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 la, drip, 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 then it's fine. But if you, oh, come on, water, clean the patch. Okay, no, don't do that. And the drug insert will say that. So do you expect them to read the drug insert? No, you have to tell them that. So that's part of your nursing education. You're gonna have to do with the patient on that.
Would you say the patch is like the least effective of all the?
No, patches work very well for some people. They tend to work better in small, slightly built ladies than they do in more statuesque ladies. I'm trying to be tasteful. Ladies who are quite tall, for example, may find it doesn't work as well as ladies, say, who are your height or Sydney's height, for example. You guys are more on the petite side of the fence. And usually the patch works better for smaller ladies than it does for more statuesque ladies. So this product, you wear, you have it for 3 weeks and then you have 1 week off. This product has less estrogen than Xulane, and that makes it potentially safer. That's why this particular patch is preferred by some people. The medical letter says of this patch that it works just as well as Xulane in clinical trials. Post-marketing studies will see if that bears out, but women who use Twerla say that they really like it because they saw the advantages of the combination tablet with less estrogen. So this, you've probably seen this product either in commercials or some sort of online advertisement or something like that, the so-called vaginal ring. So that delivers the etonogestrel and ethinyl estradiol. Again, you place it in the birth canal, you leave it for 3 weeks. You use a new ring for every 4-week cycle. And if you remove it for more than 3 hours, now you have to use backup contraception. The problem with the ring that I understand from the post-marketing data is that it tends to come out, tends to fall out. Now, some women don't have trouble with that, but some do. So if it comes out, then that might be an issue. Might have to do with the way it's inserted. Who knows? Who knows? So Nuva ring and Elia ring, they have efficiencies that are about the same as the oral contraceptive tablets. And in terms of depression, irritability, acne, that's supposed to be less with the rings. This is one of the second major rings approved by the FDA, Anavera. This is placed in for 3 weeks, removed for a week. The same ring can be reinserted every 4 weeks for up to a year. So it's reusable. That's one of the beauties of this. So you get one ring and one ring to rule them all, so to speak. That was bad, I know. And it's cheaper. So it's a little more cost effective. When you take it out, you're supposed to keep it in the carry bag like that, and you need to wash your hands after you touch it because there's medicine on it. Some women swear by the rings. They love them because they don't have to take pills. They just have to essentially do the insertion once a month. Why do women stop using the ring? Well, headaches. There is vaginal discharge with the ring. Typically wearing a panty liner usually takes care of that. Some women don't feel it. Others say they feel it and they don't like the way it feels. So they get some device-related discomfort. Different strokes for different folks. Injectable contraceptives are typically not preferred, but if a lady, this isn't being done very often, but occasionally you get ladies who have court-appointed birth control that has to be given. They will usually end up having to get the shots. So the so-called Depo-Provera, that's the medroxyprogesterone. So you get the shot. You typically don't have periods after 2 injections. You can have rather unpredictable menstrual bleeding with this one, weight gain, headache, abdominal pain. You do get some decrease in bone density. That's reversible. It's contraindicated in women on steroids. The American College of Gynecologists recommends no longer than 2 years for this treatment. Fertility will return 6 to 12 months after the last injection. Some women report that it comes back very gradually even after that. So the injectable methods are usually not preferred for that reason. Yeah, court appointed. This is being done less and less now. If a woman is unfit to be a mother, she's mentally troubled and she hurts her children. And so having a baby is a risk to her, and you can't put her in prison where you can just take the baby away when the baby's born. The court may say then she has to have the Depo-Provera. That's usually when it's done. Again, this is being done less and less, but there are cases where there have been court-appointed Depo-Provera shots that a woman has to have. I agree, it sounds terrible, but we live in a fallen world, and these are the compromises you make in a fallen world. All right, so the tier 3s. These are the non-hormonal methods. Condoms. First thing about condom, you check the expiration date. Don't use it past the expiration date. The only thing it's good for is filling it up with water and throwing it off top of a building. The plastic, the latex tends to break down. If you use it past the date, it's going to fail. Open the package with your hands. Don't use your teeth. No, I'm serious. Guys, this is serious. If you open it with your teeth, you may bite the condom and put a hole in it. You gotta prepare for contingencies. You know, Sydney, that's fine. Get your giggles out now. Yeah, you'll be fine. I know. They protect against sexually transmitted infections. You have to use them every time you have intercourse. Literally, you see stuff online, you can use them once and then she won't get pregnant because the condom somehow casts a spell on my sperm and my sperm won't work anymore. Okay. Please disabuse people of this mythology that you see online. It just every time I feel like I get online, I feel like my IQ goes down 40 points after reading some of this stuff. Because they're made of latex, if the guy or the gal has latex allergies and they can't use condoms. They tried non-latex condoms and they failed so often they stopped making them. The company was going to get sued and go out of business. So yeah, no, just latex. Sorry? Latex has the elasticity and the durability to be able to stretch, to be stretched that much and work. Also, it has the physical properties such that it can be put in a package like that, rolled up and put in a package and then last that long. Other products, they just don't last that long. So the expiration date is such that it's not financially feasible for the company to make them. Because by the time people get them and they get sold in the store, they expire. So
what would somebody who say they didn't want to be abstinent, but they wanted to have sex and have a latex allergy, what could they do to prevent?
they could use some of the other methods we're going to talk about. So-called pericoidal contraceptives include diaphragms, so-called cervical caps, sponges, and then spermicides. Diaphragms, cervical caps, sponges, and then spermicides. When I was in graduate school at UC Irvine, sponges were all the rage. There were sponges everywhere. Sponges were the bee's knees. Diaphragms and cervical caps, they have to be fitted. They have to be fitted with a pelvic exam. If they're not fitted, they're not going to work. If you use them with spermicides, their effectiveness increases. If you use them without spermicides, they're really not that effective. You insert them 3 hours before intercourse. They will remain in place usually for up to 6 hours afterwards. They don't protect against sexually transmitted infections. Do not use diaphragms during menstruation, increases the risk of toxic shock syndrome. The sponge, you moisten it with a little bit of water, and then you insert it. You can insert it really at any time, up to 24 hours before intercourse or right before. They'll remain in the birth canal for up to 6 hours. They can cause some dryness because they tend to suck up water from the birth canal, and because the chemicals in them sometimes can irritate the birth canal. They can be used with spermicides as well. Spermicide should be inserted 10 minutes before intercourse. The spermicide will come with an applicator that you fill the applicator and insert it. They can cause local irritation both to the guy's male organ and to the birth canal. In some cases, they might actually increase the risk of HIV transmission. Then there is a so-called rhythm method. The success rate is poor when it comes to this method just because the women's menstrual cycle is subject to variation due to stress, due to this, that, the other thing. There are couples who make this work. In England, there was a doctor-nurse, husband-wife team in our church, and they used the rhythm method and they loved it. But he was a doctor, she was a nurse. So these are two people who obviously knew what they were doing. The old joke goes like this: what do you call a couple who use the rhythm method? Parents? But there are couples who make this work. So I want to give this particular method its due, because if you have couples who are in tune with their bodies, they can make this work. You have to usually use the temperature and the consistency of the vaginal mucus. You have to do all that in combination to be able to properly map the menstrual cycle. It's a lot of work. But if you don't want to use any of this other stuff, there you are. Emergency contraceptives. Copper IUDs, you can insert them and they'll kill the sperm. So copper IUDs are pretty good in that regard. Levonorgestrel, a single pill, pretty high dose, is a emergency contraception that you can give. This is the so-called Plan B. Really doesn't work all that well. Frankly, it fails pretty often. Ulipristal, Ella, is a progesterone receptor antagonist. You take it up to 5 days after intercourse. This product is an abortifacient. So if your client has problems with abortion, even of a very young embryo, then this is not the product for them. And you need to be honest with your client. You need to tell them what this product does. If they have a problem with it, then you can work with them. If they don't, then that would be the product. Be honest and be disclosed. Don't hide things from your client. Disclose to them. They'll trust you for it. And let's face it, trust is earned. And the medical field today is suffering from a deficit of trust. And so I'm counting on y'all to win some of that back, right? Go team. Questions about contraceptives? I realize that was drinking from a fire hydrant, but these are very important groups of drugs. You will use them a lot. Since it's Easter week and since I'm feeling really nice, we're going to quit early today. So on Monday of next week, we'll go over anti-estrogens, androgens, and fertility drugs as well. And that will end the reproductive part. And then from there, we'll talk about antibiotics and anti-infectives and things like that. Please, all of you, have a very blessed Easter. Please drive carefully. And tell your parents how much you love them, because they never tire of hearing it.